Hello, everyone. I'm Lou Brady. I'm the president and CEO at Family Health Center of Worcester. The calendar just flipped to the month of December. And so, for many of you, that has you asking certain questions. Questions such as, this year, do I find myself on the nice list or am I on the naughty list? Or perhaps your question is, am I really going to enjoy that holiday treat? I'm going to enjoy that holiday treat. But for us at the health center, our focus is the same as it is every month, and that is how do we show up for the people who need us. We have since 1972 been intensely focused on access to health care for everyone, regardless, and reducing health disparities and addressing the social determinants of health. It's why the majority of our volunteer board are consumers, the people who use our services. It's to hold our feet to the fire. We have since March, when the coronavirus showed up on our shores, been focused on how do we deliver care safely and how do we keep our patients safe. And it's meant making investments with funds that frankly we didn't have. But we were able to borrow a lyric from the Beatles, rely on a little help from our friends. And with that, we were able to make investments in PPE and in air exchange and disinfecting equipment and in the staff and all the things that we need to deliver care safely. And so we're grateful to our legislative leaders and our foundation friends and the Worcester Together Fund and all the individuals who showed up with PPE in their trunk and small donations and lunch, and even just the people who called in with well wishes. We were so very grateful to have those friends. As we move into the month of December and into January, we're seeing a spike in the coronavirus cases. As a matter of fact, in Worcester County, in the last 2 weeks of November, our case count went above the peak that we saw in April. And I'm concerned because we weren't actually able to test all the people who wanted to get tested. Capacity lagged demand significantly, so there may be even more cases out there unaccounted for. We know that we need to ramp up to meet the needs going into the winter and into the spring. Additionally, we know that there's a vaccine just on horizon, expected to land this month, and we're going to need to develop our capacity to deliver those vaccines to our communities, to the people who live and work locally. And right now, that will be a stretch. And so we know that we're going to need a little support to make this work. So we're going to ask you for two things. The first is in the next few months to really maintain a diligence around the pandemic preparedness and keeping yourself safe. And what does that mean? That means maintaining a distance from people who aren't within your household. Stay home when you don't have to go out. Avoid large crowds. If you find yourself in a crowd, maintain a social distance. And no matter what, when you're in a crowd or when you're in with people that you don't know, or excuse me, you may know them, but they aren't in within your household, to wear a mask. Wearing a mask is the safest way to protect yourself and to protect others. And so please wear a mask. The second thing that we ask is that you consider supporting us. And you can support us by going to the website giveamask.org. If you go to giveamask.org and make a donation of $100 or so, you can support our capital campaign and help us to add more to the safe environment that we operate in. That donation will yield you a mask that says wear a mask in 7 different languages. Now, we at the Health Center, we deliver care in 55 different languages. We couldn't get all 55 languages on the mask, but I think we get the point across with 7 different languages. And so making that donation gets you that custom mask that says that says wear a mask. It also will result in one of our patients getting a mask. And so you've doubled your impact. You're wearing a mask and you've got a mask, and someone in the community who needs a mask now also has a mask. And that improves our resilience as a community. And so we ask that you go to giveamask.org and support our capital campaign. And we will get through this. Vaccine is just around the corner. The health center continues to be here, to be focused on delivering care and testing and treatment. And with your help, we will emerge on the other side of this stronger. Thank you so much. Appreciate your time.